who are lifting up the voices of some of our most vulnerable neighbors at a time when they can't advocate for themselves. All of you have troubling stories to share today. It was after the first COVID-19 outbreak that, as chairman of the Health Subcommittee, I convened a meeting to explore what was happening at nursing homes and elsewhere after 35 residents and staff members had died. And we know those numbers soared significantly. And what we saw was not a new problem, but an old problem that had just been exacerbated by COVID, a crisis in staffing that was affecting the quality of care and had been for decades. 2 decades ago, in fact, long before the pandemic, the Center for Medicare and Medicaid Services that we know as CMS conducted an independent study to try to determine what would be the safe and healthy standards that should exist for staffing in our nursing homes. Well, their report, which provided detailed findings and reasons for them, has been blocked by the nursing home industry for about 20 years. Finally, this spring, the Biden administration acted and came out with some modest standards that aren't not all that I would like to see, but they represent a very important first step forward, and they provide some hope to these nursing home staff workers and to the residents themselves. Now the industry that blocked action for 2 decades is insisting that nothing be done again. On the Ways and Means Committee in which I serve, we have already seen passed on what was essentially a party line vote, a measure under the Congressional Review Act to repeal and stop this action by the Biden administration. If they're successful, again, there'll be no action to save lives through safe standards that would occur. And last night, the same resolution was introduced over in the Senate. So next week, at any point, we could see action on an attempt to totally roll back the modest progress that's been made. I think it's pretty clear that the nursing homes that cry out that they'll have to shut down or they can't deliver services, can't pay reasonable wages, that those are the kind of arguments that really just collide with the facts. The independent MedPAC study that was done in 2023 found that these facilities have exceeded 10% in profits for each of the last 22 consecutive years, sometimes as high as 17%. Similarly, another independent study found 1 out of 5 facilities have more than 100% of all of their costs fully paid in the Medicaid-based payment rates, and they get additional funding in addition to that. Still another found that 63% of nursing home profits are hidden and appear as cost when they in fact are not. Too many facilities, of course, have been stripped by private equity. Private equity that comes in and reduces staffing, takes away as much of the profits as possible, and reduces the quality of care. Another study has found that 10% reduction 10% increase in mortality rates after private equity takeover. Thousands of lives at stake as these nursing home chains consolidate and are viewed just as another place to exploit profit, not to increase the quality of care. This increase in mortality occurred at the same time that Medicare funding was actually increasing. The conditions have been so bleak that the average nursing home in America today turns over more than 50% of the nursing home staff every year. And you can imagine the challenges that are created when you have half your workforce change every year with such an important job as caring for the vulnerable. I don't think we have a workforce shortage. I think what we have is a shortage of decent wages and fair treatment for nursing home care workers.
Yeah, that's right.
Industry has obstructed progress for so long, and they think they can continue to do it. We need to protect resident and worker safety, to save lives, and have safe staffing standards. A partner throughout this endeavor who's been a leader on all issues concerning seniors is my colleague from Illinois, Jan Schakowsky, who has just been a champion on this. Jen, I know you want to add a few words and do an introduction. Thank you for being here.
Thank you. Thank you. Thank you so much to Congressman Doggett for being so dogged in making sure that we raise this issue of the safe staffing in nursing homes. And it is not just about saving lives, which it is. The lives of the people who are the residents of the nursing homes, but it also means to be treating these precious workers. I want you to look around and see who is standing here today. I want to thank the advocates and especially the working people. Is it any wonder that there is that kind of turnover in nursing homes? It is because they are not getting the wages that they need to take care of their own lives. And we have got to raise the wages. It is not a matter of just a shortage. If we were to raise the wages, if they were to get the kind of wages that they need, these are some of the most important jobs in our entire country, taking care of the most vulnerable of us, families who are depending on them for their loved ones to be in nursing homes, and workers who would like to be there for them. And we want them. We absolutely want them to be there. I just want to also add to the problem that we have, the disparity between the ownership of these nursing homes and the workers. We know that private equity has gotten involved in nursing homes, and we have seen that their executive pay has gone up higher and higher and higher at the same time as the workers are underpaid. That has got to change. We have to make sure that we raise the wages, but we also do the kinds of inspections of what happens with private equity, where we see where they are in charge, that the outcomes of people who live in nursing homes goes down. They are getting worse care and paying more money. I also just want to say that it is, as Congressman Doggett said, this is not about the low wages. This is not about that there's not enough workers, people who want to do the job. It's just a matter of the low wages. And so if we pay them, they will come. And they will take care of our loved ones. And so I just want to thank the SEIU and the workers. I want to thank AARP for their participation. I want to thank the National Consumer Voices. Is that it? Yes. And all of the organizations that stand with us for the patients and for the workers. And now it is my privilege to offer for speaking to Lakeisha Johnson from Chicago, my hometown, to talk about the real experience of the people who are doing the job that we need, all of us need to get done. Thank you, Lakeisha.
Thank you, Representative Doggett. Thank you, Representative Schakowsky. Hi, we are joining y'all today. My name is Lakeisha Jones. I'm from Chicago, Illinois, and I'm a SEIU union worker, and I'm also, like I said, I'm with the nursing home. Been with the nursing home for almost 19 years, and the good part about it is that I'm not just was in Chicago, Illinois. I started off in Rockford, Illinois, and I moved to South Carolina, and then I came back to my hometown. So I have a feel of what goes on in the nursing field from different aspects of different cities and states. And, you know, the short staffing is really, it's a burden on a lot of us, you know, the nurses, the aides, the dietaries, the housekeeping, everyone that's that work inside of that place. And, you know, it's a shortage, and it's amazing how many people that goes home burnt out to their families because they work in doubles trying to make sure that they have coverage for the people that lives inside of the nursing home, because we got to understand, you know, the corporate people, the owners and stuff, they tell us these are their homes. Their homes are designed for them to be comfortable. Yeah. We are there to meet their needs. We're not there to demand anything from them. I thank God for the pay, but sometimes that pay does not even exceed to where we need to be in life, but we still do it out of the kindness of our hearts. You know, in order to be inside of the nursing home to take care of people, you have to have the heart of God. You have to be able to go in and perform the proper care that they need to take care of them like they're your own family member, because in the end, they are our family member, because most of them don't have family that come in. We don't sit on the high horse. We go in their room. We build relationships with them. You know, and I say this to the owners, they don't come in and get to know the residents like we do. So once again, even the residents will tell them it's never about the money when it comes down to the employees, because some of our employees bring food to them out of our homes, go to the restaurants, and we buy them food. We bring them clothes. We bring them shoes. We do this because we love them. Now, as I go into this, you know, why are we here? Why am I here? I'm going to make this personal. Years ago in 2005, I ended up in a situation that I never knew nothing about the nursing field. I had a good paying job in 2005 in Rockford, Illinois, 17 some an hour. Wow, that's a lot of money. I left that field because I got sick in a hospital. And my ex-husband had to take me home with a catheter. Him and my mom was in Chicago. She came to take care of me. And I tried to bribe a lady on third shift because the other shift treated me so poorly. They was not meeting my needs. And you know you get in pain, especially at night. And I said, can I give you $100 because you took care of me? You met my needs. She said, ma'am, we cannot take money in this field. But you can do one thing. Go get your certificate. Go get your license. She said, come back and do the job that I did for you for other people. See, that's why I said you need the heart. So I did exactly what she said, and I've been in this field ever since then. And my passion is to see these people getting taken care of the right way. And so we, as a people, here it is, we struggling. They don't have towels. The owners don't want to provide us with nothing, but you want to fire people. You want to sit down and pull us out and tell us that we're doing our job wrong, but give us what we need so that we are able to properly take care of these residents. As I said, as an SEIU, HCII member, I am so grateful to say that I have seen and I have went into a lot of things that I have told God that I will become that voice to help people to get where they need to be inside of this industry.
That's right.
This work is about love and attention, because now these residents is not just someone that you go in and just do care on or someone that you just pass medicine to. These residents need somebody to talk to them, someone to comfort them. That is what these residents need, and these residents is the center of our attentions, okay?
Thank you.
Thank you very much.
My girl. Get it, girl.
Well,
tell them what we've been through.
That passion, that commitment, that's what this is all about. It's just that when that passion and that commitment has to be spread over dozens of people, it's impossible to provide the kind of service that I know each of these individuals wants to provide. I believe that it's really important that we have the support of people who are not in nursing homes, who can't protect themselves, and go beyond those who are working there, to recognize that there are thousands, in fact millions of Americans out there that will one day be in a nursing home and want to be assured that we have the care. And the leading voice for retired persons across America, the American Association of Retired Persons, or AARP as we all know it, we're pleased to have the Vice President of Government Affairs, Megan O'Reilly, here to discuss this important issue. Megan, thank you for your leadership.
Thank you. And thank you, Congressman Doggett, Congresswoman Schakowsky. I also want to thank SEIU, Consumer Voice, and AFL and others who are working so hard to protect these resident rights and protect this important staffing standard that CMS recently issued. You know, at AARP, we're the voice for adults 50 and older, and we have been fighting to ensure that the health and safety of every person in a nursing home. We've been fighting for the health and safety of every person in a nursing home. This rule that we're talking about here today is common sense. It will help protect the basic rights of residents to live in dignity. And we've heard today why this is so important, what residents are relying on the staff around them to do, and why this is so important. We must have the staff there to help care for the residents that depend on them. We commend CMS for issuing these minimum standards. Again, these are minimum staffing standards, particularly the 24 hours a day, 7 days a week RN requirement. Taxpayers spend $80 billion a year out of Medicare and Medicaid for nursing homes.
Wow.
American families have a right to expect that they are using these federal dollars to provide quality care.
Yeah.
Frankly, it is shameful that it's taken this long for us to get a federal minimum staffing standard enacted.
That's a shame. That is a shame.
We hear regularly from families and residents who have experienced the tragic consequences firsthand of not enough staff. For example, we heard from a daughter, her name is Lori, her mother's 96 years old, living in a nursing home. She's wheelchair bound, and she told us about how her mother has had to sit in urine-soaked sheets or in her wheelchair that is soaked as well because there's not the staff there to help care for her when she needs it. America's nursing homes should have the staff there needed to provide basic care that residents need and expect. If they don't have enough staff, then they should not be admitting new residents.
That's right. That's right. That's right.
In short, AARP believes every person in a nursing home deserves adequate staff attention to support their health and well-being. And we know through our research at AARP that there is bipartisan, overwhelmingly bipartisan support for these minimum federal standards. 80% of voters approve of requiring minimum staffing standards in nursing homes, according to our AARP poll. This includes 89% of Democrats, 74% of Republicans, and 70% of independents when you break that down by party line. Some lawmakers, as we've heard today, are trying to take this common sense rule away. Let me be clear, at AARP we are engaging our members in the fight to protect residents and to defend this nursing home staffing rule. In the last 3 weeks alone, we have sent 200,000 emails to Congress urging them to cease attempts to overturn the rule. In addition, on Monday, we've launched a multi-pronged campaign in support of this important rule. AARP members will continue to call and email members of Congress by the thousands each day. We have launched online ads urging lawmakers not to lower these staffing standards. And you may have seen there's a billboard truck, an AARP billboard truck, that's circling the Capitol to remind lawmakers why the nursing staffing rule is so needed. We strongly oppose any attempts to weaken or repeal these new resident protections. And let me be clear, these are law. These are final rules. So any attempts to weaken them would be taking something away from residents and staff.
That's right.
The rule has bipartisan support, it is long overdue, and it will help save lives. Thank you. Turn it back to you.
Thank you so much. All of these workers are available to visit with you, but I'd like to hear from one more to express what this is all about, how we save lives and improve lives with adequate staffing. And that's Joanne Edmond from Massachusetts. She'll add a word. Joanne? Thank you.
Thank you, Mr. Doggett. All right, Joanne.
Good afternoon, everyone. Thank you for allowing me to share a few words on this very important subject. My name is Joanne Edmond, and I'm a proud member of 1199 SEIU UHC. I want to first start off by thanking Representative Jen Schakowsky and Lloyd Doggett for continuing to show support to our cause and being our voice to the other lawmakers. I have been working in long-term care for over a decade. I have been at the same facility in Massachusetts for 10 years. I have witnessed and experienced the challenges that exist within the area of healthcare industry. Today, I am here to emphasize the need of creating a safe staffing work environment. Our elders and residents deserve all the best care they can receive. Being understaffed does not create that atmosphere. When I started in this industry, there used to be 6 CNA for 48 residents. Now, we are lucky to have 3 CNA for 48 resident. It is impossible. When nursing home owners talk about safe staffing, I ask what safe means to them. They say staffing standards will harm us, not help us. They say staffing standards are going to cause problems. Right now, we are not safe. Our residents are not safe. There are so many problems in our nursing homes, and the current system does not offer solution to those problems. Residents and healthcare workers feel like the industry doesn't protect them. Little things shouldn't be a luxury. It is up to us, the CNA, to protect our residents and give them the basic dignity of life. If not us, who? If I feel sick, I still come to work. Even on Mother's Day, I come to work to give residents some love. We are sometimes all our residents have. The federal staffing standards proposed by the Biden administration is a needed solution. It is the first step to fixing this system. This is the first time we had standard of this kind. We should embrace it, not stop it before we even try. It just makes sense. So, in the name of those lovely elders, residents, and all of us, healthcare workers, please share our story, plead our cause to the other lawmaker, because they deserve much more than this. Thank you all.
Thank you very much. So our last speaker before taking questions, but first in voicing concerns of consumers on so many issues, is Jocelyn Bogdan from Consumer Voice. Oh, excuse me, Jocelyn.
No, that's okay. Thank you. First, I just want to thank both of you for being here today, AARP, and all these incredible, hardworking workers behind me. My name is Jocelyn Bogdan. I'm a senior policy specialist with the National Consumer Voice for Quality Long-Term Care. Consumer Voice is the leading voice representing consumers in issues related to long-term care, and among the other work we do, one of the most important things is raising the voices of consumers and ensuring that they are empowered to advocate for themselves. Today, as we talk about the importance of the minimum staffing standard and the serious implications and dangerous consequences of understaffing, I want to highlight resident voices because they are the ones who live with the consequences of understaffing every day. In late 2023, we conducted a survey on understaffing and the impact on nursing home residents. Over 120 residents from around the country responded. 88% of those residents stated that their facilities lacked the staff necessary to meet the needs of the residents living in those facilities. 87% said that understaffing impacts them personally every day or at least several times per week. A few weeks ago, I spoke directly with several nursing home residents about this issue. I want to share a few things that residents shared with us in that conversation. Maurice, a nursing home resident in Maryland, talked about being left in bed day after day because of understaffing. He said, "There are days when I am not able to get up. There are not enough staff to get me into my wheelchair, and they have to prioritize who can get up on any given day because there are just not enough staff members on a shift to get us all up." Another resident, Cindy from Texas, spoke about understaffing, saying, "Call lights are not answered. Showers are not given because of not enough staff. But the most concerning thing that I observe is that our residents who aren't able to communicate and aren't able to feed themselves are being neglected because there are not enough people to feed them and look after them." We've had so many people fall out of wheelchairs. A recent fall, someone actually fell twice. They are now at home on hospice, waiting to die from their injuries. She said, "There aren't people here to supervise and make sure people don't leave the building. We've had residents leave the building. The alarm goes off, but they're not found until later in the day. There are huge safety concerns when there aren't enough staff to protect our residents." Sharon, a resident in New York, shared that at times during our second and third shifts, we have 2 CNAs covering almost 100 residents. This means waiting at least 2 to 3 hours to have someone come get us out of bed or to get us cleaned up when we need it, or even a nurse to bring us our medicine. For those of us in wheelchairs, those of us who need to get into a wheelchair with a machine, you need 2 people just to do that. And Marguerite in Ohio shared something that I think is hugely important as we think about the implications of understaffed facilities. She said, "In my facility, the staffing levels are such that maybe the most basic things are being done, like feeding, cleaning and clothing, things like that. But as residents, our lives should contain so much more than just that. Finally, because this really resonated with me, last week I was talking with residents about what they would change in their lives in nursing homes to improve their quality of life. Scott, a resident in Illinois, said, "I would want to have my face washed and my teeth brushed every day. That would really improve my quality of life and how I feel about myself." That's not currently happening for Scott because he can't brush his teeth or wash his face alone, and there isn't enough staff to make it happen. So when we talk about the critical need for this minimum staffing standard, and I should mention that none of the residents quoted above currently live in a facility that staffs at the level of the CMS minimum staffing standard, though some live in facilities that are very close, we aren't just talking about numbers. We are talking about the dignity and the lives of actual human beings who rely on staff for their daily needs. We are talking about people who are suffering daily, emotionally, psychosocially, and physically because of current staffing levels. Residents throughout this country deserve this minimum staffing standard. They deserve to live lives safely and with dignity. They deserve to have their faces washed and their teeth brushed every day. Thank you.
Thank you. So moving. We invite any questions you might have.
Can I make
Sure,
one
go
thing?
ahead. Sure, Jane.
I just want everyone to understand that the workers who are standing with the residents of nursing homes are saying they want to be there. They want to have enough people to take care of everyone, right?
Yes, we do.
And there is not a shortage of people who would do the job, except that they need to get paid a decent wage.
Yes.
And we would have all the staffing that we need. But we also see that there are nursing home owners who want to reduce the number of people that they pay in nursing homes. We have seen private equity companies reducing the number of people that they have working in nursing homes. So you are seeing the workers and the patients on the same side, fighting for justice, fighting for health care, and fighting for improvements in nursing homes. Thank you.
That's right. Any questions? Yes. It does not come with wage increases or additional funding, but basically it sets a minimum so that there will be more care than is available at many nursing homes today. The staff that will be there, how many and when will be there to address some of the problems that have been raised here. Thinking of someone who can't brush their teeth, thinking of someone who can't get out of bed, and the idea that you can't get that level of care every day because of not having enough people there to manage things is what we're trying to change. If the nursing industry can make the case that it lacks the funds, despite all the studies showing the profits that they're making and the like, I know we'd be ready to go to bat to see that the funds are made available. But that doesn't seem to be the problem. The problem with funds is that many of them are being sucked out by private equity and profits retained rather than shared with the workers who are out there doing this work. Are there others? Yes, sir. The CRA, or the Congressional Review Act, I'm very concerned about it. I saw it rushed out of the Ways and Means Committee with almost no notice. I very much respect the efforts of AARP to get bipartisan support. We need that. I believe there are some Republican colleagues who will listen to the overwhelming number of Republicans who I believe are out there and they want humane care in nursing homes just like Democrats do. But I will tell you, in the Ways and Means Committee, we couldn't get one of them to vote to preserve these rules. And now a Republican member has introduced last night the same proposal over in the Senate. I think it's just a matter of time before this hits the floor of the House, and it will be a very close vote. That's why what we're doing here is designed to draw attention to this issue and all that's at stake. Jan, you may have thoughts about that also.
I appreciate the question because it is a moment of decision. And what we need is advocacy inside and outside of the Congress to say that these really modest, basic rules should not be overturned. And we're so grateful to the administration that it happened. But now we need to mobilize, along with AARP, along with the workers, to say, don't diminish what has been added right now to make life better, both for the workers and for the people in the nursing homes.
And making clear that if this rule is overruled, if they are successful with the review, there will be no standard at all, despite 20 years of evidence of the need for one. Any others?
I want to say just one
Sure.
thing. One of the witnesses that I heard in working on this issue is someone who said that she had 20 people in the nursing home at night that she had to take care of. And guess what? It's really pretty much impossible to do that. And many of the jobs that these folks behind us are doing are really so incredibly difficult, and yet they are there with the love that they talked about for our nursing home residents.
So if there are no other questions, they're available to talk with you individually. But again, join Jan in saying thanks to you all. Thanks not only for being here, but for what you do, for the love, the care that you show. And I hope you'll convey that to your colleagues that weren't able to be here today, because they're providing that love and care right now. So we're going to work together. We're going to do all we can to prevent this standard from being destroyed.
Thank you. Thank you. Thank you. Thank you.
Sure. You bet. How would you?
Is everybody in?
Hey,
Okay.
how you
Thank
doing?
you. Good. How are you? I think I missed your name.
Thank you.
Sorry.
That wasn't me this time.
Oh.
We win!